My name is Dakota Amundsen, and today I want to talk about congestive heart failure, known as CHF. 6.5 million people above the age of 20 have congestive heart failure. I'm sure somebody you know has congestive heart failure, or they know somebody that has congestive heart failure. Even though congestive heart failure is a very common disease, not a lot of people know about it or know how to treat it or look for the symptoms. So let's talk about it. What is congestive heart failure? Congestive heart failure is when your heart does not pump blood effectively through the heart, leading to your other organs not getting enough blood as well. So let's talk about the symptoms. What are the symptoms of CHF? The first symptom is shortness of breath. A lot of people will complain of not being able to breathe when they lay down. They say they feel like they have a ton of bricks on their chest. Another symptom would be fatigue. They're tired. They're tired of doing their daily activities. It feels like a chore, walking short distances, not being able to brush their teeth without feeling shortness of breath. Another symptom is edema. Edema is whenever you have fluid overload in your arms, in your legs, in your hands, and your feet, and when you press it, you're going to get that pitting feeling. You're going to get an indentation. So, whenever you have CHF, how can you be diagnosed with CHF? Well, your doctors can do echocardiograms. They can do a EKG, they can do chest x-rays, they can do blood work. So, if you get diagnosed with CHF, what are the medications? So, a lot of doctors will prescribe beta blockers. They will prescribe blood pressure medications. They will do diuresis to get that fluid off of you. So, if you're at the end stages of CHF, a lot of people will have to have a CABG. A CABG is a graft. They take a healthy vein in another part of your body and they will move it to your heart to restore proper blood flow. Another device that you could use when you're at the end stages of CHF is a VAD, known as a ventricular assistive device. This device hooks onto the side of you and it helps pump blood effectively. So, how can we prevent getting CHF in the first place? A healthy lifestyle. Healthy fruits, healthy vegetables, exercising daily, getting your heart pumping. No alcohol, no nicotine, no vaping, no smoking. Especially staying away from stress. Another thing that I would highly suggest is getting a cardiac heart failure management check-self plan. This will help you maintain your cardiac issues. It will tell you, it's a little chart that tells you if you're all clear, if you should go to your care provider, if you should go to the emergency room. It will tell you right up here at the top if you should weigh yourself in the morning before breakfast to make sure that you're not in fluid overload. Check symptoms as swelling of feet, ankles, legs, your belly, seeing if you have shortness of breath, taking your medications. Again, monitoring your intake, low sodium, low fluid intake. And another thing I would like to mention is to make sure that you are going to your doctor's appointments regularly and remember that you are in complete control of your health.